What's up, beautiful people? Another day, another study. We've talked a lot about black seed oil on the channel. We've talked about it for knee arthritis. We've talked about it for allergies. We've talked about it for sleep. This was a study looking at black seed oil and some of the physiological changes associated with menopause. So we know menopause is a physiological transition that's associated with a decrease in certain hormones like estradiol, and that can lead to symptomatology such as hot flashes, decreased libido, brain fog, other things, right? And so the biologically active agent in black seed oil is a flavonoid with antioxidant and phytoestrogen properties. And phytoestrogens are plant-based compounds that have estrogen-like properties and either directly or indirectly act on estrogen systems inside of the body. This study was a placebo-controlled randomized controlled trial. They used two different doses of black seed oil on assessing estradiol, FSH, and the vaginal maturity index, which was basically looking at cells under a microscope and calculating a number, and less than 52 indicates vaginal atrophy, which is a condition that's associated with menopause. So the women had menopause for between 2 to 10 years, had BMI less than 30, no surgical removal of the ovaries or uterus, and general pretty healthy population. The placebo group saw a decrease in estradiol levels at 8 weeks, while both black seed oil groups saw an increase in estradiol levels, and there's no significant difference between the two. FSH levels increase in the placebo, and what happens in menopause is you'd see a higher FSH level, usually above 40, while the FSH levels decreased or stayed the same in the black seed oil group, and the VMI, the vaginal maturity index, stayed the same in the placebo group, but it increased from below 52 to around 59 to 60 in both black seed oil groups. The limitations here, this was a single site study done in Indonesia. It was single blinded, not a lot of people in this study. And one of the biggest things for me is they didn't measure symptoms or quality of life. We know when dealing with a lot of the sex hormones that the most important thing, in my opinion, is symptomatology. Levels are important, but I really want to know if those levels are correlating with symptoms. And so a follow-up to this type of study would be another randomized control study where they're looking at symptoms and in my dealings with menopausal patients, what they really care about, symptoms and, of course, quality of life. That would be really important to look at to see if black seed oil is making a difference in those things. So I wouldn't recommend it for menopause or menopausal symptoms. It may be interesting, and I may monitor this in patients who I recommend black seed oil for other conditions if we do see an improvement in some of these menopausal indexes.